Managing our mental health and finding ways to support those around us is something we all want to improve upon, especially when we are in an environment which can be stressful, challenging, pressurizing, and maybe even sometimes traumatic. In these next few minutes, I want to help you understand what individuals may be experiencing and give you some tools and strategies to not only gain insight, but to also support those around you. Okay, so to get started, I wanted to help you understand psychological risk factors, stress, a little bit about trauma, and then I would like to leave you with some practical tools and tips to support your teams. First, let's review psychosocial risk factors and the impact they can have on individuals in various ways. Here's the thing. Psychosocial risk factors are things that may affect workers' psychological response. The risk can impact their performance and their interaction with others. Although not an exhaustive list, they can include things such as tight deadlines, production content, being away from home, past events, management styles, or even feeling a lack of control in a new environment. Next, let's talk about the S word. Yep, you guessed it, stress. Stress is often one of the things that sneaks up on us as we are not used to addressing stressors when they arise, hoping that things will get better tomorrow or next week or maybe just after production. Individuals experience stress when the demands of their job are excessive and greater than their capacity to cope with them. In addition, when stress goes unaddressed, it can lead to greater mental health challenges such as anxiety and depression, which are the number 1 and 2 mental illness. It's vitally important that we recognize signs and symptoms of stress, as well as offer resources and support to manage stressors when they arise. A few signs and symptoms of stress can include decrease in performance, becoming easily agitated and irritable, showing up late to work, increased emotional reactions, or becoming increasingly withdrawn. Okay, so one last thing I want to share with you before I give you some practical tips. Let's talk briefly about secondary trauma. All of us working on sensitive issues are at risk of developing secondary trauma. Secondary trauma is the emotional duress that results when working with others that have been traumatized from hearing about the firsthand trauma experiences of another. This can result in individuals having emotional outbursts, mood swings, avoidant behaviors, and even engaging in self-destructive behaviors. Now, you can imagine with these psychological risk factors, stressors, and secondary trauma that you may never fully understand how past or present situations can impact the well-being of an individual. With that said, here are just a few tips to keep in mind as you work to support others. Number 1, implement caring contacts. Caring contacts are intended to be a proactive measure. It includes briefly checking in with individuals to connect and show that you care. In addition, it provides an opportunity to offer support if it is needed. Keep in mind, this is not time to discuss projects or performance. Number 2, normalize symptoms. When symptoms are observable, validate the individual. Let individuals know that they are not alone and that their responses are not uncommon or wrong. This will help to minimize the stigma. Number 3, encourage connections. Connections with others is a key component of psychological health. It involves turning to family, friends, or trusted coworkers in times of need. Number 4, stay away from why questions. During conversations, stay away from the word why. Why questions often come off as accusatory and blaming versus supportive. Try words or phrases such as tell me, share with me, or even start with what. Number 5, awareness of available resources. Now, keep in mind, we are not asking that you become a therapist overnight. However, it is important to understand the available resources so that during the conversations, you can share or remind individuals of the support available. Lastly, number 6, agree on next steps and follow up. Provide a brief summary of what you heard and agreed upon next steps. In addition, ensure that you follow up with the individual to check in to see how things are going since that last contact. As the phenomenal Dr. Maya Angelou stated, people will forget what you said, people will forget what you did, but people will never forget how you made them feel.